Hello, I am Arna Goswami and today I'll be talking about my device, the TempSeze monitor, which aims for continuous temperature monitoring for febrile seizure management. Feb- Febrile seizures occur most often in children, infants ranging from 6 months to 5 years of age. A febrile seizure occurs when the temperature go above a certain level and which can be generalized into either simple or complex seizures. During simple seizures, it lasts less than 15 minutes or occurs once in 24 hours. It is exactly the opposite in complex seizures. It lasts more than 15 minutes and occurs more than one time in 24 hours. Uh, Several disorders are characterized by such fevers and seizures. Among these, central nervous system infections are also prone to occurring. A correct differential diagnosis from febrile seizures leads to an appropriate treatment, possibly preventing further severe complications. Importance of proper diagnosis. Proper diagnosis is very important when dealing with fever associated seizures or epilepsy because accurate identification of the underlying condition can significantly impact treatment and outcomes. Proper treatment during essential time can prevent the possible evolution into epilepsy. A recent study by Tarhani et al. Has reported that 90.91% of the seizures were not properly diagnosed and ended without proper medication. Recent studies emphasize that accurate and continuous temperature monitoring plays a crucial role in the diagnosis and treatment of these seizures. Currently, continuous monitoring of an infant's body temperature is known as neonatal intensive care units, utilizing specialized medical equipment to ensure precise and real-time temperature regulation for critical care. We have developed a device equipped with a high precision temperature sensor capable of detecting changes with an accuracy of plus minus zero point 0.1 degree centigrade, ensuring a reliable and real time monitoring for effective intervention. In the event of a seizure, the device promptly informs caregivers, enabling them to seek immediate medical attention and provide timely care, improving the patient outcomes and mitigating risks. This is our proposed prototype, which senses it from a wristband like device and plots it in a mobile app. The main function of our device is to sense the temperature, plot temperature and time in a mobile app, inform parents at time of seizure, and keep track of number of seizures in 24 hours. To tell the basically keep track where the seizure is complex or simple seizures, as discussed in the second slide. This is the module which we have created, which uses a medical grade TMP 117 sensor using a ESP32 dev module to control it. The code we have developed is such that it will automatically measure the temperature and plot the graph of the temperature by time. This is what a device should look like in the prototype form. A toy like device wristband which will constantly measure temperature and send it to the mobile. This is a this is the graph where data was sent using our temperature sensor. These peaks are when the person exhaled and the lower temperature points are when he inhaled. This is a temperature by time graph. Now I'm going to demonstrate my module which contains the temperature sensor and ESP32, and I'm going to show its code and its reaction with contact with body temperature. This is the sensor module which I have. It's a medical grade TMP 117 sensor, and this is an ESP32 which I've connected using jumper wires. The ESP32 is connected to the computer via a USB port, and I have the code here, and temperature is being monitored in this graph. So when I touch the temperature, as you can see, a spike occurs. Similarly, when the temperature of the child goes above a certain level, a spike is going to occur. This way we can sense whether a febrile seizure is occurring or not.